Good evening, class. I hope you're doing well today. For today's class, I wanted to add one more thing before moving on to the next lesson. Now we will talk about functions of the body. First of all, we're going to look at the 5 senses and some other functions our body has. I'll give you an example which includes 2 of these senses. So imagine you're hungry, you're in a restaurant and the waiter brings your food. You smell it and it stimulates your appetite. So you want to eat. Your mouth waters, filling with saliva. You take a bite of the food, it tastes good, and you chew it and swallow it. Then you eat more and more, but then suddenly you taste something unpleasant and you feel nauseous. You rush to the toilet and get there just in time before vomiting all the food you've eaten. So this was a short example of smell and taste. Now, in addition to smell and taste, the senses include sight, which is vision, and hearing and touch. Touch is also called sensation or feeling. To ask about the senses, doctors use the question, what is your sight like? What is your hearing like? Or is your sense of smell normal? Is your sense of taste normal? These are the most common questions doctors use. But to ask about the sense of touch, doctors talk about numbness, which is loss of sensation. For example, have you noticed any numbness in your fingers or toes? When they ask something like this, they mean like, have you noticed any loss of sensation in your fingers or toes? So here you have some functions of the body. In this chart, you can read some terms such as speaking, walking, speech, breathing, and things like this. So we'll start by reading them. It is separated into function, the verb, and the noun. So first we have speaking, which is the function. So the verb for the function speaking is speak or to speak. But the noun we use is speech. Like, for example, do you have any problems with your speech? Next we have walking. As the verb, we have to walk. For the noun, we use the word gait, but the word step is the most common word for walking. But both are correct, so you can use either gait or step. Now for the next one, we have breathing, which is the same as respiration. And for the verb, we have 2. It depends of the action we are doing, because breathing involves two different actions. So we say inhale for breathe in or take a breath in, and the verb exhale, which means breathe out. So for the noun, we have breath. Have you noticed that both the verb and the noun are pretty similar, but they are different in pronunciation. So we have breathe in or breathe out, which sounds like an E sound, breathe. And we have breath, which is the noun, and it sounds like an E sound, breath. Next, we have urination, which is the same as micturition. You can say both of them, both are correct. And now we have the verb, which is urinate or to urinate, and the verb micturate. You maybe will also hear your patient saying it like pass urine or pass water. All of these are correct ways of referring to urinate, so you can use either of them. Now, for the noun, we have the word urine. Next, we have defecation, and its verb is defecate or to defecate. But you can say pass feces or pass stools. And lastly, we have menstruation, and its verb is to menstruate. But you can also say have a period. So for the noun, we have the word period, which also has two meanings. First, in the menstrual, we have the period referring to the blood, and for the monthly, we refer as a period of time. That's the meaning of period in that context. So now, when taking a history, doctors can ask, do you have any trouble walking, or do you have any pain when you breathe in? They can also ask, do you have any problems with your speech, for example? And also when auscultating, for example, a patient's lung, the doctor tells the patient instructions like take a deep breath in, holding your breath, and then breathe out completely. That could be an example for a doctor's instruction to their patient when auscultating. But what about less common functions? There are some things we do less often, like when we are hot, we sweat. So, and when we are nervous, we sometimes shake, or when we are sad, we cry. So you can ask your patient things like, do you sweat more than usual, or do you shake more than usual? Now, with all of this vocabulary and also with your medical knowledge, I want you to complete these exercises. Okay, here it says match the symptoms to the questions using your medical knowledge. Please read carefully every question, and we'll check your answers once you're finished. Okay, time's up. Now I'll check your answers. These are the answers. In number 1 we have dysuria. The correct answer is, do you have any pain when you pass water? In number 2 we have dysphagia. And the correct answer is, do you have any trouble swallowing? Number 3 we have diplopia. For this one the correct answer is your vision normal? In number 4 we have dysphagia. So the correct answer is, do you have any difficulty with your speech? And in number 5 we have dyspnea. And the correct answer is, what is your breathing like? Okay, this exercise was pretty easy, so let's move on to the next exercise. Now here, patients are describing their symptoms of the conditions shown in parentheses. So you have to complete the sentences with the words you believe they would use. So let's begin. Okay, now let's check your answers. Number 1. I've got pain and numbness in both feet. This is for peripheral neuropathy. Number 2. I'm having difficulty swallowing solid food. This is for esophageal stricture. Number 3. I have a lot of problems passing urine or passing water. This is for prostatic hypertrophy. Number 4. I've been sweating more than usual even when it's not hot. This is for hyperthyroidism. Number 5. I've noticed my hands shake when I'm not using them. And this is for Parkinsonism. Number 6. I have trouble breathing when I climb the stairs. And this is for left heart failure. Now let's move on into the next exercise. Here you have 6 incomplete statements. Read carefully and write the correct answer. Please start now. Now let's check your answers. Number 1. When I eat solid food, I have to chew it for a long time before I can swallow it. When I eat solid food, I have to chew it for a long time before I can swallow it. Number 2. Do you have any pain when you pass stools? Do you have any pain when you pass stools? Number 3. I have no appetite and I've lost 5 kilos in the last few weeks. I have no appetite and I've lost 5 kilos in the last few weeks. Number 4. When did you last have a period? When did you last have a period? Number 5. The garden is full of flowers, but my sense of smell has disappeared and I can't enjoy the perfume. The garden is full of flowers, but my sense of smell has disappeared and I can't enjoy the perfume. Number 6. Take a deep breath in. Take a deep breath in. Okay, now with all of this done, we are ready to start lesson 3, which is medical and paramedical personnel and places. In this lesson, we will talk about practitioners, specialties, and the hospital staff. So we know doctors, also known as medical practitioners, must be qualified. I mean, they have to have an university degree in medicine. And for example, in England, they must be registered and included in the General Medical Council list. This council is a public body that maintains the official register of medical practitioners, but this is only in the United Kingdom. Every country has its own department where doctors have to be registered on in order to practice. A doctor who treats patients, as opposed to one who only does research, is called a clinician. So now, a doctor who provides primary care for patients is known as a general practitioner or GP, or he or she is also known as family doctor. GPs usually work in a group practice. A larger group practices work in a building called healthcare. Okay, now so let's move on to specialties. Specialist doctors, for example pediatricians, generally work in hospitals. However, those who work outside the hospital, providing private healthcare, may have consulting rooms. The two main branches of medicine are surgery and internal medicine, and the doctors who practice these branches are called surgeons and physicians, as we saw in our first lesson. So, how do we refer to a doctor who studied a specialty? Well, for example, we have a cardiologist. He or she specializes in diseases of the heart and circulation, or cardiology. And also we have a geriatrician. He or she is a specialist in diseases of elderly patients, or geriatrics. And an anesthetist specializes in anesthetics, or we can say that is a medical specialist who administers anesthetics. Okay, so notice that names of specialties usually end in ology, and names of specialists usually end in ologist. If the name of a specialty ends in "ix", the name of the specialist ends in "ician". But as always in English, we have exceptions, as in anesthetics and anesthetist. So here we have a paragraph about Jill Matthews, who has just graduated from medical school, and she is talking about her future. This is just an example. Now please listen carefully. I haven't decided what to specialize in yet. I need more experience before I decide, but I'm quite attracted to the idea of pediatrics because I like working with children. I'd certainly prefer to work with children than, say, elderly patients, so I don't fancy geriatrics. I was never very interested in detailed anatomy, so the surgical specialties like neurosurgery don't really appeal. You have to be good with your hands, which I don't think is a problem for me. I've assisted at operations several times, and I've even done some minor ops by myself. But surgeons have to be able to do the same thing again and again without getting bored, like tying off good arteries and so on. I don't think that would be a problem for me, but they need to make decisions fast, and I'm not too good at that. I like to have time to think, which means surgery is probably not right for me. Notice that the words good with is followed by a noun. For example, he's good with children. And the words good at is followed by the ing form of a verb, which is the gerund, or by a noun. So we have like she's good at performing surgeries, or she's good at surgery. Now, as always, we are going to practice with some exercises. In this first exercise, you have to write sentences to describe the work of the specialist in each branch of medicine. Here you have 5 specialties and an example, so you can start writing. I'll give you a few minutes to finish this exercise. You can be as creative as you want with your sentences, so you can practice your writing. Please start now. Time's up now. Here are some examples of possible answers. Of course, these are shorter than the ones you wrote, but these are just for you to compare. In number 1, we have a dermatologist specializes or is a specialist in diseases of the skin. In number 2, we have a rheumatologist specializes in or is a specialist in diseases of the joints. In number 3, we have a traumatologist specializes or is a specialist in accident and emergency medicine. In number 4, we have a pediatrician specializes or is a specialist in diseases affecting children. And in number 5, an obstetrician specializes or is a specialist in managing pregnancies. Now for our next exercise, you have to complete a table with the words we have learned. You have to put a stress mark in front of the stress syllable in each word. The first one has been done for you. As usual, you have 5 minutes to complete it. You can start now. So now time's up and let's check your answers. So now you can check where the stress mark should be in each of these words. I'll read each of these words so you can listen the stress marks. Specialize, practice, consult, assist, graduate, qualify, specialist, practitioner, consultant, assistant, graduate, specialty, practice, consultation, assistance, graduation, qualification. One more time. Specialize, practice, consult, assist, graduate, qualify, specialist, practitioner, consultant, assistant, graduate, specialty, practice, consultation, assistance, graduation, qualification. Now in this exercise you have to find prepositions that can be used to make word combinations with the words in the box. Then use the correct forms of the words to complete the sentences. I've done the first one for you, so use it as an example. You can start. Now let's check the correct answers. For the number one is specializes in. So a pathologist specializes in diagnosing disease through examining cells and tissues. Number two, the correct answer was working with. A pediatrician must enjoy working with children. Number three, interested in. An oncologist is interested in the diagnosis and treatment of cancer. Number four, good at. A psychiatrist must be good at counseling. Number five, good with. A neurosurgeon must be good with her hands. So now let's move on to the next exercise. Now you have to make word combinations using a word from each box, and two of them can be used twice, so please read carefully. You can start now. Time's up, so now let's check your answers. Our first combination is consulting rooms. Then our second combination is general practitioner. In number 3 we have general practice. Number 4, group practice. Number 5, health center. Number 6, internal medicine. And number 7, surgical specialties. Again, consulting rooms, general practitioner, general practice, group practice, health center, internal medicine, and surgical specialties. Okay guys, thank you for joining this class. See you tomorrow for lesson number 4.